Nigeria, the most populous black race in the world and the giant of Africa, has been burdened with increased cases of sexual and gender-based violence, child marriage, obstetrics fistula, and female genital mutilation. Its very existence have a very devastating effect on its survivors and denied them their very human rights. The consequences of SGBV are appalling, as some lucky survivors suffer huge short and long-term effect to their mental and physical health.
When we invest in women and girls, we invest in a more equal society. We invest in societies that thrive, where women's full potentials are developed and where also the girl child have an opportunity to finish her education and to realize her full potential.
And if women are still being mutilated, if women are still being violated, we cannot be talking about inclusiveness. And if we don't talk about inclusiveness, we can't talk about family development. We can't talk about community development. We can't talk about national and global development. So obviously, the issue of gender-based violence has come to the forefront.
These trends in SGBV have worsened to about 45% because of the COVID-19 pandemic, with many survivors subjected to victimization or cast off from their families. This puts them at significant risk of poverty, isolation, and further violence.
Tashi sai na ga jikina ba yadda na saba gani ba, sai muka sai ni mai bayani gashi ce shi ba shi ya yi shi ba, sai muka ji nan akwai wata ƙungiya ta taimako ta yara ƙanani da wanda an ka ci zarafin mu, mun ka to mun kai bayani, an ka tahi an ka kama shi, an kai mai hukunci daidai da abin da ya aikata.
Addressing these social norms of SGBV and harmful practices in Nigeria, UNFPA, in partnership with Global Affairs Canada, began its intervention in 3 key states, Sokoto, Bauchi, and Oyo States. At the core of their intervention is the reduction in the prevalence of SGBV and its subforms by providing an enabling environment, treatment, and care for affected women and girls, and prevention of future occurrences.
We started with by engaging our community people, the traditional rulers, the religious leaders, the community leaders, youth leaders, because Oyo State believes in one thing: nobody should be left behind.
My CSO, Community Awareness and Development Initiative, supported by UNFPA, we're able to carry out multi-level community sensitizations, community town hall, traditional rulers training, and the issue of printing messages that we deliver to liberal religious congregations.
Perpetrators of gender-based violence stand to lose, if they are traditional rulers, stand to lose their titles if it's confirmed that they intervened in covering up cases of rape against girl child.
Then we have had so many sensitization programs on the VAB law, engaging women groups, youth groups, to sensitize the community on what the law entails.
Especially as it regards to the enactment or passage of the Violence Against Persons Prohibition Law in Bauchi State. It was passed in 2020 with the assistance of the United Nations Population Fund and Canada. Were able to gazette the law in the state. And aside from that, we're able to build the capacity of judges, of magistrates.
Training also with law enforcement agents, community-based organization, and civil organization. So this training involves sensitization. And of course, Oyo State now has a family court. And of course, we have a referral center, Abiyama, where persons or those who have been sexually violated can go to.
The statistics and the gory indices of the gender-based violence globally and nationally, the participants were made to become more alive to their responsibilities, especially the law officers, and gender-based violence cases are treated with dispatch in the Ministry of Justice, and legal advice done within a minimum of 1 week and a maximum of 2 to 3 weeks. Unlike the previous situation when a case can last for up to a year.
We have also domesticated our Child Rights Act to become Child Protection Law, and we have drafted our gender policy in the state. We have also established sex referral center in the state and shelter for the survivors.
At the community level, UNFPA inaugurated or introduced this community GBV response and referral network, which they are doing a lot beautifully.
UNFPA provides a set for us and a toll-free line, which enables the other people to be calling free of charge without putting money in their line.
Another major worry is the concern for the girl-child early marriage. Its fallback effect is the increasing number in child marriage. 43% of women aged 20 to 24 were married before or by 18 years, resulting to an estimated 22 million child bride, which represents 40% of all child brides in Africa.
So it was so excellent. Traditional rulers are well enlightened, religious leaders are well enlightened, and the consequence of early marriage. And then I don't believe you can hear the early marriage closer now. It is also in the far rural area you can hear issue of early marriage, child marriage.
During this our intervention, we have a group that we call husband schools.
Nobody will think that you can gather a lot of husbands in one room and then discuss issues that concerns women with them. But it worked. And community dialogues also worked, because at times people don't even know the situation that people are facing until you engage them. And that is when they'll say, we didn't know, but you have told us now and we know better. And we can help. And this is the way we can help.
These role models, they also go into house to house to see where, if our girls has problem, especially the mothers that always keep their girls indoor, that they don't allow them to go to school. So these role models, they play a great role in enlightening the mothers and even intervening to see that these girls went to schools.
We have also had safe spaces in schools where we catch the young girls early to teach them all they need to know, because they need to have a shoulder where they can also lean on, or support services where they can also learn other educational factors that involves their adolescent lives.
A program that will assist, or an intervention that will assist in reducing this dropping out of the adolescent girl is really important and imperative to our development. So that's why we welcome your program, and we are very happy with its content. I've gone through the curriculum, and I'm very enthusiastic in adopting it. More importantly, register its content as a subject, as a non-conventional subject in the daily routines, of the girl child.
What the children learn, as I told you, has been put into practice because you can see the changes even among the girls, how they interact with people, and also what they learn based on personal hygiene, based on the health reproductive system, So there are a lot of infants, there are a lot of skills that they have acquired. And they are even contributing within the school and even within the community in enlightening people about it. So that's one of the skills that they have learned, and they are demonstrated within the school and also outside the school.
As far as I am educated, now I'm in SS1, and others that don't have the opportunity to come to school, I'll also advise them. As far as I don't have anything to help them, I'll advise them. Only my advice maybe to help them to pick up. And that is why I want to talk about safe space. Even though I grew up, I'll be whatever I want to be, but I'll still be talking about safe space because it has helped me throughout my life.
The risk of female genital mutilation is estimated at 14.8 million come 2030. This is following the prevalence rate of 19.6% amongst women and girls aged 15 to 49 whom have been mutilated. Oyo State is known for its unabated practice of female genital mutilation. Under this intervention, UNFPA, in partnership with Global Affairs Canada, engaged in high-level sensitization in different local government areas of the state.
We started by having core trainers, that is, trainer of trainees, which were drawn from these 5 local government areas. After which, we were able to give comprehensive training to our health workers so that they'll be able to provide both preventive and management care in their respective health facilities.
We were trying to identify how do we ensure that the success we're going to get now will be long-lasting. So we identified the in-school children, and that we want to really take them, catch them young, and instill them with that good moral practice and dietitian harmful traditional practices.
One of our major strategies in this organization is community health literacy, whereby we go to the communities with information on issues that bother on health and the well-being of women and children. So we had done a lot of radio programs in Yoruba. We had gone to communities to sensitize, at least awareness on the negative effects of this FGM, which is a social norm practice that has been on for centuries among our people.
Through this project, we have been able to reduce the incidences of FGM. People are now even coming out to talk about FGM. We have a case now pending in court under prosecution. So people are coming out to talk about FGM.
If we get to know of any girl to be mutilated, they have been told how to. They've been given telephone numbers. If you are being abused, if anybody wants to violate you, you can call this number. So we have different groups that can respond rapidly if there are cases in the communities.
The surveillance team actually monitor and track that the community truly are keeping to the word and the oath that has been signed. And to date, 10 communities have declared abandonment in Oyo State and have erected signboards that say that FGM is no longer a practice and will no longer be tolerated amongst their midst.
And all our health facilities are situated in the grassroots. So the health workers serve as a very good link, an educator, to make sure the practice stalls. So they are provided with comprehensive training for them to prevent the practice. And this they did through Health Talk.
So we have community champions who are still working. We still facilitate them to work. They still go about in different groups to talk about FGM as a sort of reminder even for the communities. So that's an issue of sustainability at the local level. At the government level, the government is trying to take ownership of many of these issues, and I think they need to be supported to do it. And we got to know that the agency, the SGBV agency, is being conceived. When we have such and it's fully on ground, I think the government will be forced to put in more funds, more resources. We'll be able to cover many more communities because we have thousands of communities that are also not yet reached. If we do that, I think we'll be talking of sustainability at every level.
Wọ́n ti máa ń ṣèdánilẹ́kọ̀ọ́ tẹ́lẹ̀ bọ́ nǹkan kan tí ẹni yẹn fi kún lọ́jọ́ yẹn tó jẹ́ kémi náà wò bíi pé kínní máa ní í ṣe lóòótọ́ ó ní wípé wọ́n ṣe ìdánilẹ́kọ̀ọ́ yẹn dórí pé ọ̀pọ̀lọpọ̀ ilé tí ó ń dàrú lénìí pé 85% níbẹ̀ abẹ́ dídá ó kó ìdá kan.
And even we are giving them the song like èèwọ̀ ni ẹ má ṣe mọ́, èèwọ̀ ni ẹ má máa ṣe o, abẹ́ dídá fọ́mọ obìnrin ó ti dèwọ̀.
Partnering with the UNFPA Canada has been so beautiful, and it has been a blessing to Oyo State government and Oyo State citizenry as a whole.
Obstetric fistula is one of the most serious and tragic childbirth injuries. Without emergency intervention, obstetric labor can last days, resulting to death or severe disability. Approximately 150,000 women and girls are awaiting treatment, representing 7.5% of global burden and 13,000 new cases annually. Still, fistula is almost entirely preventable. UNFPA, in partnership with Global Affairs Canada, also focus on caregiving, treatment, as well as sensitization on the effects and causes of fistula in a bid to curb further occurrences.
UNFPA, when they came, I remember in 2019, they trained, we had basic level fistula training. So I can vividly tell you confidently that I'm now a fistula surgeon. I have no fear examining or repairing any type of fistula.
As a supporting agency, they have done much in terms of training the staff, both the nurses, the doctors. They have gone to the extent of renovating the ward.
It will help us to create examination units inside the wards so that we no longer have to examine patients in the operating units. And also, they have supplied us with consumable for pull effort and also for routine repair. And also they have supported the center with consumables for free cesarean sections for repaired fistula or fistula survivors.
Then we also organize fistula repair campaigns. In this process, we do a lot of jingles, community mobilization, including training of fistula survivors as advocates, where they go into communities, mobilize people, talk to women about birth preparedness, talk to men about the importance of supporting their wife during pregnancy and childbirth, where they identify fistula patients, they now refer to either Nengi, Mariam Abacha, Goronyo, or Gamawa.
After the treatment, some of them regain back their life, they even remarry and they get pregnant again. So this center still see these women who are pregnant. We offer antenatal services to these women, and we deliver them through cesarean section. And all those services is also free of charge.
Also in the rehabilitation program, we have rehabilitated the patient, not only the patient, but the family. The husband is also part of the treatment. Because if the family, if the wife is rehabilitated, the income that will go back to the family is also what is going to sustain the family. So in that aspect, has been a holistic fistula treatment under the UNFPA program.
UNFPA also made it possible to establish a center that is near or as close to these people that are suffering from these diseases. I can tell you one of these centers is the one in Gamawa. It improved our number of repairs significantly to about more than 20%.
Excellent among the impact is the new center at the Goronyo Hospital, General Hospital Goronyo and Goronyo local governments at the eastern part of the state. It has reduced travel time, it has reduced suffering for people, and also brought BBS service nearer to the people in the rural areas.
Da ina cikin ƙalubale da tsangwama, ƙazafi, zarafi, cin fuska da duk dai abin da ya biyo baya. To ana haka aka min aiki na warke kyauta ba tare da ko rana ba. A yanzu da ina kuka da idanuna, gashi yanzu ya zamo tarihi na dawo ambassador.
Yan uwanmu mata kuma muna ta sanar da ruwa akan matsalar yayyan fitsari, yawan doguwar naƙuda tana jawo yayyan fitsari. In mutum bai sani ba ma yana biyowa ta kafan mu raka shi domin dan ya je shi ma ya sami waraka idan an Allah ya yarda.
It is clear enough that the UNFPA, in partnership with Global Affairs Canada Intervention, has indeed made an impact in these 3 states.
This is something in my whole career that I think has had one of the greatest positive results from all angles.
So in all the 3 states where we are with the Canadian government now, that is Sokoto, Oyo and Bauchi, there we are already now discussing with the government how do we continue so we can really harvest all the gains from these projects. And that is around government has counterpart contributions. It is about ensuring that they also in their own budget allocate funding towards maintaining, for instance, the healthcare workers. It's about appointing more women in leadership roles. So it's a more holistic approach that leads to more equality, leads to better health for women and girls, and of course leads to rights and choices for women and girls in the States, which eventually will lead to a world that UNFPA is really championing, which is a world where every pregnancy is wanted, where every childbirth is safe, and every young person's potential is fulfilled.
Gaskiya ina godiya kwarai ga wagga kungiya ta taimakon mata saboda ta ceto mu daga cikin abin da muke ciki. Da muna ganin bamu da 'yanci, amma yanzu mun shigo cikin mutane.